Hey guys, me, Dr. Cox here from Ground to Overhead Physical Therapy. Today we're just going to work on some hinge work. This is very important for basically anybody. It doesn't matter if you lift, if you run, if you have any type of activity that you're doing, because we have to get into a hinge. It's just a very functional pattern. What happens with a lot of us is we end up rounding our back. So if we're picking anything up, even light, that's where you get people saying, I threw my back out. Because we're pulling up and using those big, huge, strong back muscles as opposed to the strong leg muscles we have, and then making sure that we engage our core. So the first beginning portion of it is just sometimes we need a little bit of reinforcement and some cueing. So you have a stick, if you have a long pole, this is a PVC pipe, you're going to hook it up kind of right along your spine. So you should be in line with your head, middle of your trunk, and your tailbone. However, not all of us are perfect humans. Sometimes you have a little bit more forward head. That's fine. If you feel like you're having to reach to get back to the stick, we don't want that. We also sometimes have a little bit more kyphosis in our back. If that is also the case, please do not overcompensate by trying to lean your head back to touch the bar. So in standing in neutral, we kind of want those 3 points of contact. However, again, we might just end up with 2. Now, you're going to hold on to the bar. Please don't make sure you have the shoulder mobility to do this as well. If you do, you can kind of change hands. The idea is just kind of keeping that bar in its place. And we're going to work on keeping those points of contact, coming down, and then pushing, driving through the floor to push ourselves back up. What we don't want to see is that you go far enough down that we start to notice it comes off of our tailbone and our head as well. Again, if you have a little bit of kyphosis, you can still do this, keeping in line with your tailbone, right? Also, when we come back up, we don't want to arch and feel that center of our back and our low back coming off really far off the bar. So this is a good one to do quite a few times, just so you get the feel for it. Driving back up, kind of like a teeter-totter. Coming down, pushing through the floor, driving back up, keeping everything in line. Say your shoulders don't have that kind of mobility, you're having a tough time getting, that mobility with that kind of work. We can also go to a wall, and you can work on not being so terribly far from the wall, and then bending. Now, be careful that you're not far from the wall, because we don't want you actually reaching back for the wall. It's not a very good position to be in. It does stretch your hamstrings, it does keep your back flat, but nobody's doing a deadlift that way. So again, back hip flat, nice and close to the wall, and just kind of hinging down to those glutes hit, driving back up and coming back up. The important part is pushing through the ground, coming back up to standing. If you're starting out in the deadlift, I tell people, or hinge or squats or anything of that nature, you don't want to go too much further than when you feel stretching your hamstrings. If you go past that stretching your hamstrings, we start to round again. This again is just to get you starting in that mobility. We need this movement to squats, to deadlift, to pick things up off the ground, to get on and off the toilet. This is not something that's isolated for one group of people. So again, these are beginner workouts for you. If you like the suggestions we're giving you and they're bringing you kind of your strongest, healthiest self, hit the subscribe button and come back in next time for our next episode.